The theme of the disease is the moderating effect of impulsivity on the relationship between university student impulsivity on suicidal risk. University student psychiatric disease and suicide problem are showing an increasing trend day by day because of interpersonal relationship, employment status, and economic difficulty. According to the report's data regarding suicide rate by age group for 2019 in the Ministry of Health and Welfare, the suicide rate diminishing in all age groups. On the other hand, it was indicated that the suicide rate is not decreasing in their 20s. Their suicide rate their 20s of South Korea standing at 16.4 people, thereby being higher by 1.6 times than the average of OECD countries. In this respect, a separate suicide prevention measure for university students is in the real situation of being imminent above all. The psycho-emotional problems such as depression, anxiety, impulsivity, and cognitive vulnerability are being classified into risk factors of predicting suicidal behavior. Here, impulsivity implies the tendency of responding speedily and indiscriminately to internal or external stimulation without considering a negative outcome available for inflicting on oneself or others. Kleiman is reporting that people with high impulsivity have a probability of psycho-separating or provocative and extreme behavior, thereby having a high level as well of the acquired capability for suicide, results in likely coming to commit more dangerous suicide. Regarding suicide risk, Joyner suggests that suicidal thoughts could be reported if they had difficulty in interpersonal relationships. The helping of a change in negative self-awareness on oneself through positive experience in a relationship leads to coming to free from the dangers of suicide. In this way, a role of sympathy in personal relations form and maintain the basic helping relationship and make available for true human encounter, thereby playing the role of facilitating communication. Empathy is a process of putting yourself in the other person's position and thinking. The lack of empathy ability function as a major factor of instructing prosocial behavior, thereby being aware of act as a cause for violence, addiction, delinquency, and impulsivity. Accordingly, this study is intended to inquire into whether a difference is indicated in impulsivity according to university student impulse level. Synthesizing the result of previous researchers, people's impulsivity and suicide risk can be known to be possibly changes depending on empathy ability level, and university student impulsivity can be known to function as a causal variable of raising their suicidal risk. Hence, this study aims to check the modulating effect of empathy ability in a relationship between impulsivity and suicide risk, After selecting impulsivity as a variable for changing the influence of impulsivity upon a suicidal risk. Next, the study method is explained. To conduct this study, a questionnaire survey was carried out targeting students who are attending university where are located in Daegu and Gyeongbu, including students who are gave insincere response or refused to disclose information among 793 people who participated in the questionnaire survey. 772 people were finally selected. In this study, three measured tools were used. First, a measure of suicidal risk. The study used the scale that Go, Kim, and Lee adapted, modified and supplemented through applying the suicidal probability scale that Kuhl and Gill developed. The use of average values as each item implies that the higher average mean leads to the higher suicidal risk. Second, to gauge impulsivity, this study used neutral personality tests that on and on send out this Big 5 personality scale, which was developed by Costa McLean. The research analysis was applied the standard T-score, and it is implied that the higher average value leads to the higher impulsivity. Third, to measure impulsivity, this study used the scale that Pratt adapted, modify and supplement the interpersonal reaction tool, which was developed by Davis. The use of average value as per each item implies that the higher average mean leads to the higher impulsivity. The detailed data analysis method is as follows. The correlation analysis was conducted to examine the relationship between suicidal risk, impulsivity, and impulsivity of university students. Second, to look into the modulating effect of impulsivity in the influence of impulsivity upon a suicidal risk. The three-step modulated regression analysis that Baron and Kenny presented was executed. Thus, to grasp whether the form of modulated variable is pure of quasi-modulating variable. The analysis was carried out by applying a method of distinguishing of modulating variable that Durant-Guari suggested. Here, the pure modulator means that the modulated variable does not affect a dependent variable, and the quasi-modulator means the modulated variable affects of the dependent variable. This is the research. As a result of the examining a correlation among suicidal risk, impulsivity, and impulsivity in university students, past the whole and subspectral of suicidal risk are showing a significant negative correlation with the whole and subspectral of impulsivity. Second, the remaining factors, including hostility factor, out of subspectral in suicidal risk, indicating a significant positive correlation with the impulsivity factor. Third, all the whole and subspectral of impulsivity are representing a significant negative correlation with impulsivity factor. Next, the modulating effect of impulsivity was examining the influence of the university student impulsivity of suicidal risk. The first step of verifying the influence of the independent variable on the department variables. The second step of the verifying on the influence of the modulating variable on the dependent variable. And the third step, explaining the modulating effect on the impulsivity from the influence of dependent variable on the dependent variable. All three were found to have to significant impact. Thus, impulsivity means modulating the impact of impulsivity on suicidal risk. In consequence of inspecting the form of a modulating effect, even the modulating variable in the interaction term appear to be significant. Thus, the impulsivity can be known to play a role of a quasi-modulate variable. As a result of checking an effect, it implies that the higher impulsivity leads to the low influence of impulsivity and suicide risk. The whole value of suicide risk was seen to have a significant influence. Thus, a modulating effect was verified on the value by subspectra of suicide risk. As a result of verifying the modulating effect of impulsivity in the influence of the university student impulsivity on negative self-assessment, it was found that impulsivity modulates the influence of impulsivity on the negative self-assessment. The shape of the modulated variable is a quasi-modulated variable, and as a result of examining the effect, it was found that the greater the impulsivity, the weaker the positive influence of impulsivity of negative self-assessment. As a result of verifying the modulating effect of impulsivity in the influence of university student impulsivity on the suicidal ideation, it was found that impulsivity modulates the influence of impulsivity of suicidal ideation. The shape of the modulator variable is a quasi-modulated variable, and as a result of examining the effect, it was found that the greater the impulsivity, the weaker the positive influence of impulsivity of suicidal ideation. As a result of verifying the modulating effect of impulsivity in the influence of the university student impulsivity of hopelessness, it was found that impulsivity modulates in the influence of the impulsivity of hopelessness. The shape of the modulated variable is a quasi-modulator variable, and as a result of examining the effect, it was found that the greater the impulsivity, the weaker the positive influence of impulsivity on hopelessness. However, as a result of verifying the modulating effect of impulsivity in the influence of university student impulsivity of hostility, it was found that impulsivity did not modulate the influence of the impulsivity of hostility. This is the discussion and conclusion of this study. The discussions according to the result of this study are as follows. In consequence of the impacting the influence of the impulsivity upon the suicide risk as step 1, the outcome was found that the higher impulsivity and university student may lead to higher suicide risk. These results suggest that people who think of suicide may have affective and emotional impulsiveness, and the plan approach to reduce individual impulsiveness need to be taken in terms that the higher the impulse, the more fatal suicidal attempt can be made. As step 2, the influence of university strength and possibility upon our suicide risk was checked. As a result, it was shown that the higher impulse ability leads to the lower suicidal risk. The most important impulse ability in forming positive interpersonal relationship can not only reduce our suicidal risk, but also play a role of preventing a person who already attempted suicide from thinking of suicidal ideation and more. In the aspect, the enhancement in an individual impulse ability can be known to be very important. As step 3, a modulating effect of the impulse ability was checking in the influence of university and impulsivity upon a suicide risk. As a research, it could be known that the influence of impulsivity upon the suicide risk can be dropped when the level of impulse ability as a modulating variable gets higher. In the preventive approach for bringing down impulsivity and suicidal risk, it is very crucial to improve university strength impulse ability level. Hence, before exploring the influence upon a suicidal risk, the program and educational approach need to be made so that university strength can enhance empathy ability in interpersonal relationships. Next, as a result of regression analysis for each subspectrum of suicide risk, it was found that there was a significant modulating effect of impulse ability in all factors except hostility. It is mentioned that the influence of causality among impulsivity, negative self-assessment, suicidal ideation, and hopelessness, depending on impulse ability, can be varied. In the case of hostility, it was found to be insignificant from the first stage of verifying the influence of the dependent variable on the dependent variables. A slight difference can be shown in that hostility has a closer relationship with the cognitive and affective aspects, but that impulsivity may have a close relationship with the behavioral aspect. The previous research is saying that there may be high possibility of causing behavioral problems such as temper tantrum, aggressive and violent behavior. Extroversion includes hyperactivity rather than cognitive and affective difficulty because of having difficulty in control on behavior. When impulsivity is continued, is hinting at which the impulsive as a causal variable of hostility may have significant impact. Finally, this is the significant and recommendation of this study. First, this study has a meaning with regard to having target university students who are shown a trend of continuously rising among subjects with a suicide attempt by age. Second, The study inquired into impulsivity as a causal variable, which is one of the behavioral problems which are showing in common in people who are linked to a suicide attempt. Furthermore, to find a plan for decreasing university students' impulsivity and suicide risk, the impulsivity level corresponding to a relational factor was applied. Third, this study checks with the causal that the subspectra of suicide risk have within impulsivity and whether there is a difference in influence among variables depending on the impulsivity level. Basic data could be secured by inspecting that the impulsivity can act as weakening the influence of causal among subspectra of impulsivity and suicide risk. This concludes the presentation. Thank you.